there, my name is Brooke Galloway. I am a third-year vet student at the Ontario Veterinary College, and today I'm going to go over some cow anatomy with you, and this is Amino, and she's going to be helping me out today. So to begin, cows have two eyes just like you and I. They have 2 ears. Over here, Amino. This is her poll up here. And then working down, this is her nose. She's got 2 nostrils. And she's got a muzzle. As you can see, it's a little distracted eating right now. But a fun fact about cows is actually that they only have teeth on the lower half of their mouth. They don't have teeth on the upper part of their mouth. They have what's called a dental pad. And this is just to help them pick up as much food as possible as they can in one bite, as you can see Amino's doing right now. Alright, moving down towards the back of Amino, we have her neck. We have her jugular furrow, which is where veterinarians would come and draw blood if we needed to take blood for anything. We have her brisket here. And then here we have her scapula, which you can't really see, but this is the front of her scapula, and then this is the back of her scapula. Right here we have her elbow, which is called the olecranon. And then right here we have her humerus, which is the equivalent to our human arm. And then moving down Amino's leg, we have her, what is equivalent to our forearm, which is her radius and her ulna. And then here we have her knee. And then moving down we have her cannon bone, which is also called the metacarpus. And we have her withers up here. A test that some vets would do is called the withers pinch, which is done basically to see if they have any kind of abdominal pain. So we would basically just pinch her withers, and then the natural response for her is to flex her back. So if we don't see that, then we're a little worried about some kind of internal pain. Moving into the heart, which is right in this general area. Veterinarians would listen to this side to listen to her tricuspid valve. And basically we got to push our stethoscope really in beneath the leg in order to hear her heartbeat. And then moving on to her lungs. Her lung field would be basically right here. So I would listen to a bunch of different spots in this lung field in order to hear for any kind of cracking or wheezing. Just make sure her lungs are working fine. And a fun fact about cows is they have 13 ribs. And the fact that you can see them is not a big deal. That just means she's in good body condition. Alright, moving down. This is called her paralumbar fossa. So this is where we would listen for any kind of gastrointestinal issue. So if we were suspicious that she was bloated or had a twist of any kind, specifically on this side, a right displaced abomasum, we would percuss this area and then listen with our stethoscope to see if we can hear a ping. And if we can hear that ping, then we're worried about a bloat, basically. Alright, moving back, we have her hip bone, which is called her tubercocci, or some people call it the hook. And then we have her pins, which is the tuber ischiae. And then in here we have her thurl. So the thurl is made up of her ilium and ischium. Now I'm going to take you through the hind leg of Amino. So we have her femur bone here, which you can't really see, but that's equivalent to her thigh. And then we have her tibia, which is this kind of bone here, which you also can't really see, but that's in that general area. Then you have her hock here, which is her tarsus bone. And then in the back, you have her metatarsus, which is the back cannon bone. And then I'll take you through some foot anatomy down here if you wanted to zoom in. We have her dew claws here, her pastern, which is kind of right here. And then she's got 2 toes, which are also called digits right there. And then moving to the rear of Amino, we have her back view of her hip, which is here. We have her tail head. This is her tail, and then this is called her switch. And then if we wanted to take blood back here, we would lift her tail, and there's a vein that runs here that's called the coccygeal vein, and it's very easy to take blood So you just stick the needle in there, grab some blood, and then we have her vulva here and her anus. And finally we have her udder. So this big vein. This is called the milk vein or the subcutaneous abdominal vein. And this is important on the cow because, as you can imagine, there's a lot of blood involved in making milk. So all the blood that's supplied to the udder is ultimately brought back to the heart via this milk vein. Alright, and then you can see here, this is her foreudder. This is kind of the foreudder attachment right here where it attaches to the body wall. And then on this side of the udder and on the other side, you have your lateral suspensory ligaments, which ultimately suspend the udder from the body wall. So if we get up close in here, you can see that she's got 2 foreteats. So basically the udder is split into 4 compartments called quarters. And ultimately the way it's separated is we have the median suspensory ligament that runs down here, and that separates the udder into 2. And then on the inside of the udder we have a very thin membranous membrane that separates the udder into 4 quarters. And each quarter, you can see, has its own teat. So a fun fact about the cow is that they actually have 4 different stomachs that each do very unique things. They have the reticulum, the rumen, the omasum, and the abomasum. And the biggest one that pretty much takes up this entire side of the cow is called the rumen. So if I wanted to listen to rumen contractions with my stethoscope, I would place my stethoscope here, and I would basically hear 1 to 2 contractions per minute in a healthy cow. And basically the contractions just sound like a big washing machine going off. And if you wanted to learn a little bit more about the stomachs of the cow, I highly suggest that you go watch Dr. Andy Robinson's Rumen with a View, as he talks a lot more in depth about the different stomachs.